And Dr. Poland, your recording is now on, so please proceed whenever you're ready.
Thank you very much, Dr. Perez. And most of all, I thank all of you for taking your valuable time today to hear about the important topic of suicide prevention. There are a couple of things that I'd like to you answer in the chat box, if you would. First and foremost, I wonder if you lost a loved one to suicide. I'd also like to know your work setting. Are you in a hospital? Are you in a school? Are you in a mental health center? Or maybe another location that I'm not thinking of? And then I'm very interested in your views on COVID-19. Will it increase suicide rates? Will they stay about the same? What are your thoughts? And I want to begin by acknowledging that with a large number of people registered, I'm sure I'm not the only one that had my life affected by a suicide. I was 25 when my dad shot himself. He was a Marine in World War II in the South Pacific, and after the war had really lifelong problems with depression and alcohol. And I know I'm not alone. If you lost a loved one to suicide, I think I have some idea what you have gone through, but I believe strongly in prevention. And I'm actually a good example of somebody who just did not think it could actually happen in my family. And I devoted much of my career to youth suicide prevention. In fact, I'll never forget going to work in the schools in Texas and being appointed to director, and several kids died by suicide. And please know that us survivors, we really prefer that term, died by suicide. If you tell me my father committed something, I might say you commit a crime, you commit a burglary. But I really didn't do much. I wasn't asked to do much after these suicides, and superintendent called me into his office and he said, "Scott, what are you going to do about this?" And I said, I don't really know. He said, "You better figure it out." And that was 39 years ago. And I am trying to figure it out. It's been my highest priority. I've written and lectured on this subject very, very often. But, I still remember a poem that a teacher handed me one day too late. It was entitled, "A Small Flower. Come and touch me, hold me, use me for a gift to someone, for an arrangement in the den, for anything. Please don't toss me out while my leaves are fresh. If they do turn brown and crinkle, remember what I was before I faded away." Now, that's not the most explicit suicidal poem you've ever heard, but it certainly had heartache and non-existence. And what do you think that teacher would wish 39 years later? The same thing I wish with regards to my father. I'd have just sat down and I'd have just asked, are you thinking of suicide? Are you thinking of giving up? There is help available. You're not the first person to feel this way. I will be there for you every step of the way. And I'm very pleased to represent the College of Psychology and our university, and we truly do believe in community service. Now, here's the bottom line. And I remember going to a conference years ago. The presenter spent almost all of his time showing me every chart imaginable about suicide rates. I finally raised my hand and said, I know it's a problem. I came in here to find out what to do about it. But very quickly, unfortunately, suicide rates are at the highest in 50 years. And the number of suicides for the year 2018 is an all-time high. It's the 10th leading cause of death for Americans across all ages. It's the second leading cause of death for people between the ages of 10 and 34. Certainly, it affects males more than females, as you see here. Many concerns about the suicide rates for veterans and for middle-aged Caucasian men. And there's been a pretty dramatic increase just in a 1-year time with the suicide rate for middle school age youth. Guns account for 50% of suicide deaths. And I'm wondering, do you know which states have the highest suicide rates? What are they? Think for a moment. If you said they're all in the West, you're absolutely right. Actually, New Mexico has the highest rate right now. Alabama, Montana, Wyoming, they are always the highest. We could spend most of our precious hour together talking about why, but those are states that have a lot of rural areas. Those are states with a lot of gun owners. Those are states that lack mental health services. And those are states with a high percentage of Native Americans. I don't want to oversimplify, but the bottom line is suicide rates are the lowest in states that have stricter gun restrictions. Suicide rates are lower in the East than in the West. Now, the real question that everybody wishes they had the answer to is, what will happen to these high suicide rates after and during our pandemic? And what might contribute to the rates increasing? So we've all had reduced access to extended family, friends, religious participation, community support, and mental health services. And connections, I don't want to oversimplify, but basically the Center for Disease Control says it's all about connections. When we lose somebody to suicide, we should think we failed as a school, as a community, as a church. And what can we look to in terms of our history to help us now? Well, the Spanish flu pandemic was nearly 100 years ago. We do know suicide rates have increased when we've had a downturn in the market, when the stock market has crashed. But on a more positive note, we know after 9/11, when we had a terrorist attack, and after natural disasters, Americans pulled together, and that is a wonderful thing. Who might be the most at risk with the pandemic for suicide? Well, I think it's logical that elderly Americans who are already at risk if they have family, health, and financial problems, and really anyone who loses a loved one because of the virus. And then, since most of my work has been about young people, yes, they could lose a young person could lose a loved one to the virus as well. But I'm concerned that more people may be in poverty than ever before because of all the financial problems that people are experiencing. So an adult may be facing poverty. Children may now be facing living in poverty because of the virus. The most widely accepted model of suicide is Joyner's interpersonal theory model that says this desire of suicide has two main factors: perceived burdensomeness. So if you ever know somebody who says, my family would be better off with me dead, that is definitely very concerning. And then there's low or thwarted belongingness. And we're not able to connect as much as we normally can. Although, thankfully, the technology does enable somebody, for example, to have a Zoom meeting, get the entire bowling league on there, get your extended family, and then be very alert for what is termed by Joyner acquiring the capability of suicide. This could be a young person that's engaging in self-injury. This would be somebody who's taking chances and has had some strange injuries. This could be somebody who's getting comfortable, they're habituating, and they are starving their body. So be alert for someone acquiring the capability. And also, to quote Joyner, suicide is not cowardly. Suicide is fearless. It takes a lot to overcome our most basic instinct, which is to stay alive. Now, I mentioned a little bit about myself being a survivor, but probably many of the nearly 1,000 of you, some of you have definitely lost loved ones to suicide. There are about 5.4 million survivors in the United States. It's been called the most complicated grief there is. It's like your loved one left their skeleton in your closet. And we now believe that when a suicide occurs, it affects as many as 135 people, and it affects 18 of them in a profound, life-altering way. To be honest, much of suicide prevention is actually driven by survivors. We're not going to give up. We don't want this to happen to anyone else's loved one. And please remember, after a suicide, no one thing, no one person is ever to blame. And sometimes I hear, how could they do that to me? They were not thinking about you. They were just wanting to end what they believed was unendurable pain. They were experiencing constriction and tunnel vision. Now, if I was on the webinar today, I'd want to know what works from the World Health Organization. Reducing access to lethal means, especially with children interrupting those adverse childhood experiences. What do I mean by that? Living in poverty, living with a substance abusing or mentally ill parent, being physically abused, emotionally abused, sexually abused, having lots of losses. And my brother called me recently. He had just arrived here in Florida at his condo. He was very concerned when he heard his neighbor Brian was seen in the parking lot yesterday holding a gun to his head. Well, I asked my brother, was Brian rushed to the emergency room? No, he wasn't. Well, Steve, do you know, does Brian still have guns available? I asked his wife about that. She said, I can't remove his guns. Those are Brian's. And then my brother said, Scott, what difference would it make? Wouldn't he just find another way? No, Steve, the research says absolutely not. You remove the lethal means. Or if somebody survives the suicide attempt, they almost never go on to attempt again. So please, Steve, see if you can remove the guns. Then I asked a little more and was told that Brian is suffering from advanced stages of Parkinson's. Steve, I have a hypothesis here. I bet his physician is treating the Parkinson's, but not the accompanying depression. I'm really proud to tell you that my brother took his friend Brian to the doctor, and Brian confessed about his suicidal behavior. Brian is getting treatment now for his mental health issues, and the guns have all been removed. And we don't have to have a degree in mental health to reach out as a caring human being to help somebody who is suicidal. And I'm going to express a frustration now, and that is, we've known for decades that about 2/3 of the people who died by suicide actually went to see their family physician shortly before they ended their life. I know my father did, and I only wish that his doctor would have reached out and would have asked questions about hopelessness, giving up, and direct questions about suicide. So the common warning signs, and I've actually already mentioned a few of those, but we need to be concerned when people are talking about death, dying, and suicide. And they might write it, they might say it, they may make statements about feeling hopeless, they're in despair, they're feeling trapped, they may be giving away prized possessions, they might make out a will, they might have dramatic changes in behavior with regards to energy, sleeping, eating. And most individuals who died by suicide exhibited one or more of these warning signs. I already mentioned the importance of means restriction, but I want you to know that the website at Harvard summarized the research from all around the world. You raise the barrier on the bridge, you remove the gun, suicide rates go down. And in my work helping adolescents, sometimes the conversation with the parent goes like this: I don't think she knows where my gun is. I don't think she would possibly know how to load it. Dad, I'm telling you, your daughter is suicidal. She's planning to use your gun. Please lock it up. This is not a question of gun ownership. This is a question of responsibility. So, what are the protective factors from the World Health Organization for all of us? Connections to family, the workplace, friends, school, the community, and having problem-solving skills. And I want to use an example. And my son was 8 years old when I said, Jeremy, I need to talk to you a little more about the death of your grandfather. He said, well, Dad, I'm sorry I never met the man, but you told me he had a heart attack. Yes, he did, son. But 2 weeks after his heart attack, he shot himself. The word is suicide. Now that you're 8, maybe you can understand that. And I want you to hear this from me, never from someone else. He thinks a moment and he says, you lied to me. No, I didn't really lie, just waiting to give you the complete information. Then he thinks a moment and says, well, your father wasn't a psychologist like mine. He couldn't possibly have taught you the importance of feeling good about yourself. Everybody has problems, Dad. You just have to know to get help. Now, obviously, he was trying to alleviate my guilt. What's the most important point there? He's 8 years old. He believes he's a good person. Whatever comes along, he will get help. And that's the message for all of us. We can get through this. We need to get help. We need to access mental health services. We need to know when and how to get help. And I'm just going to illustrate something that maybe most of the 1,000 of you know, but what if I push this button and tell Siri, I want to kill myself?
I didn't get that. Could you try?
I want to kill myself.
It sounds like talking with someone might help. The National Suicide Prevention Lifeline offers free and confidential emotional support.
All I have to do is tell Siri on my smartphone and push a button. Isn't that something everyone needs to know? I don't have to remember a complicated number. And religious involvement, whether it's a temple, whether it's a church, whether it's the mosque, is very, very preventative for all of us. So, what are our particular challenges? Many communities lack adequate mental health services. And having worked in the schools full-time for 26 years, and I talked with school personnel virtually daily, we don't have enough school psychologists, counselors, and social workers. The guns in many of our homes are not properly stored. And unfortunately, there still remains stigma about seeking mental health treatment. and not everyone knows those warning signs and how to take action. And when I read of yet another suicide, I usually think of it pretty simply: untreated or undertreated mental illness. And a concern is that many of our training programs for mental health professionals do not adequately cover suicide risk assessment and management. Many of those professionals have to seek that information out on their own after graduation. So let's spend a few minutes talking very specifically about Florida high school students, because the Center for Disease Control does a survey every 2 years for high school students and at-risk behavior. Now, I'm only showing you today the data about high school kids and suicide. Look at the percentage. A third felt sad or hopeless 2 or 3 weeks or more during the last 12 months. 15.6% considered suicide. 11.8% made a plan. Now, let's look at the bottom figure, because I can look out my window right now and I can see Nova Public High School. For the sake of simple math, let me round it off to normally there would be 2,000 students in that building. What's this mean? 158 of them made a suicide attempt within the last 12 months. Who's the most likely to make an attempt tomorrow? The kid with the previous history. But you know what's really scary? For the most part, I'm going to argue their parents, their teacher, their counselor have no idea about their suicidal behavior. But who would know all about it? That would be their friends. But most of the time, we never talked to kids about what to do to help yourself or your friend, because we're afraid to talk about it. Too many people believe if I bring this up, it might plant suicide in their mind. Nothing could be further from the truth. If somebody's suicidal, it gives them a chance to unburden themselves, to realize they are not alone. There is help available. And by the way, our current generation of middle school and high school students here in Florida, if we actually talk to them about what to do, if we shared with them the warning signs of suicide, it doesn't have to happen. It's not fate. It's not destiny. Then the next generation of adults would actually know what to do when they had a suicidal roommate, coworker, or elderly neighbor. Now, what are the myths that are really holding suicide prevention back? First of all, suicide rarely occurs on a whim. Somebody has traveled a very long road, even if they're only 12 years old. And there's often what's called a precipitating event. They've thought about it for a very long time, but there's a severe argument. There's a big disappointment. There's a problem at work. There's a financial issue, or maybe they're about to be arrested. Those are the things that cause them to act on their previously thought out suicidal plans. And let me quote Voltaire for a second. 1764, I'm only going to slightly change his words. The young man in the fit of melancholy who died by suicide today might have wanted to live had he merely waited a week. You see what your job is? Help that person get through a difficult day, a difficult weekend. I've had kids say before, oh, who am I to get involved? I mean, it's Jim's fate, it's just destiny. No, it is not. This is not destiny. This is not something that is inherited, and we must talk about it more. Yes, there is a relationship between bullying and suicide. It's not a causal relationship, but how can you rule out untreated and undertreated mental illness or adverse childhood experiences? But there are a lot of lawsuits about bullying and suicide, and I've been involved in many of those. One I was involved in, Brandon Meyer, he was 10 years old in Missouri. He wrote a suicide note. He drew a picture of himself hanging. The note said, "If somebody doesn't stop me, I will hang myself at 4:35 today." He handed it to a middle school girl. I'm sorry, he handed it to a 5th grade classmate because Brandon was only 10. Had anybody ever talked to her about that type situation? Anybody ever prepared her in 5th grade in church or around the kitchen table? She had no idea what to do. She didn't tell an adult. Brandon Meyer died that afternoon, and he sued the school, his family did, because of they believed the failure to stop the bullying Brandon received contributed to his death. And we could spend a long time today on self-injury. The bottom line is it's habituating. It's working up to suicide. The question that I've always asked is, how do we figure out? Because large percentages of kids engage in self-injury, i.e. cutting, most commonly. It releases endorphins, it regulates emotions. But when might they turn to suicide? Well, the cutting behavior has diminishing returns. And be on the lookout for, are they using multiple methods? Have they done this for a long period of time? Do they disassociate when they cut? Do they experience little pain? And what am I really leading up to? If you know a kid's engaging in self-injury, you need to ask them directly, are you thinking of suicide? When you know a kid is a victim of bullying, same thing. Don't hesitate to ask them, are you thinking it's hopeless? Are you thinking of giving up? Are you thinking of suicide? So here is a quick scenario for you. I hope you'll read it, and I hope you'll say out loud wherever you are, and most of you are probably in your homes. The kid is saying, ever since the breakup, I haven't been able to study. I just found out I'm losing my job. I'm not sure I want to live anymore. What would you say to that person? Many of you will encounter someone who says something much like that. I hope you responded by acknowledging it sounds like you're really overwhelmed. I hope you wouldn't hesitate to say, are you thinking you would give up? Are you actually thinking of suicide? You know, you're not the first person to have those thoughts. There is help available. I will be there for you every single step of the way. We can't be dismissive. It doesn't do any good to give them the pep talk or to say, oh, I know you'd never do that. Instead, it should be, I'm here for you. We are going to get you help. So, since I've spent most of my career in schools, I just like to share with you what I see are the barriers. Most school leaders have no idea suicide is the second leading cause of death for kids between 10 and 17. They also have no idea that many upper elementary students talk about suicide. And I gave you the tragic example of Brandon Meyer, who died by suicide, who was only 10 years old. I know schools are asked to do a lot, but they should not be afraid to talk directly to students about suicide. I'm very sorry to tell you, Florida is not a state that has any mandates for suicide prevention in schools. About 20 states have those mandates, and Florida needs them as well. and schools need to link with community, county, state agencies, and initiatives. Schools should not be expected to prevent youth suicide alone. They need to work on it with all of the state and county resources. And as I already said, it would be my greatest hope that in the future, because of what they learned in school, every American would know what to do to prevent suicide. So moving on, very proud to tell you, with my wife, a former principal, we did a number of state plans. There's the plan for the state of Texas. We did 2 of them to prevent suicide in the schools. We did a plan for the state of Montana, and a hard copy was mailed to every single principal in that state. We're just putting the final touches on the school guide to prevent suicide, the New Jersey GPS. And I'm proud to tell you, a Nova doctoral student and I, Catherine Ivy, are just completing the Florida Steps School Toolkit for educators to prevent suicide. And we interviewed many key stakeholders here in Florida. And we hope to have this toolkit, which will have over 30 downloadable forms to use for suicide assessment, notification, training, etc. And with regards to bullying and suicide, I'd like to just call your attention to the Suicide Prevention Resource Center, which has a wealth of information on all aspects of suicide prevention, but specifically, they summarize all the research about the relationship between suicide and bullying, which is a strong association. Also, at sprc.org, you'll find the Weekly Spark. It's a newsletter. It's free. It comes to my email every Friday, and I always look at it to see what's the latest research. Is there more funding available? Is there something we could apply for? Now, the bottom line is there's a lot that has to be done after a suicide. And please know, nobody ever said do nothing after a suicide. We need to reach out to family, friends. We need to view it as a time to teach suicide prevention. And it's a time to repeat, no one person, no one thing is ever to blame for a suicide. There is never a simple answer. That person traveled a very long road. I'm pleased to tell you, yes, I was one of the people who helped develop this guide. And if you work in a school, I hope you will download it. I hope you will have it. I had a conversation last week with a school psychologist here in Florida. The high school lost a student, and she was trying to get the principal to pay attention to this toolkit and to call the family. We need to reach out. We need to talk about warning signs. We need to help everybody with their grief, their confusion, their shock. We need to identify those people that now might be more at risk. So who do we talk about? Who are all the kids at the high school this year already known to be suicidal? When a suicide occurs, wherever it is, it's like taking a rock and throwing it into the community. That ripple effect is everywhere, into the schools, into the churches, into the community centers, because somebody actually did what I have been thinking about. So we've got to reach out to every single student known to be suicidal. We have to reach out to the closest friends of the victim. We must reach out to his family and to the surviving siblings. We need to be promoting mental health for everybody. And we need to tell the truth. And that always involves discussing with the family. And hopefully, and I've been pretty successful in my career saying something like this: please know, I will never be theorizing about why your daughter did what she did. But if we can simply acknowledge, sadly, yes, the death was a suicide, we will be able to help her friends in the best way possible. And we'll be able to talk about what everybody needs to look for to prevent further suicides. I always get asked these questions, and I will only answer them in a classroom size group or smaller. That guide says clearly, I got it written on page 30, no assemblies about suicide. Why is that so important? Because kids are not going to ask questions. You're not going to get a read on how they're experiencing this particular topic. Somebody is going to go out the exit, and all you know is she had brown hair. And especially no assemblies after a suicide. Everybody always wants to know, why did he or she do it? The answers have died with them. We will never know. I'm here to help you. You lost a family member. You lost a coworker. You lost a friend. What method did they use? You'll find some debate about this, but I find it the simplest to just say, it was a gun, but we're not going to dwell on details. Let's go back to how I can help you and what thoughts are on your mind. Now, our son's the minister, not me. But I always get asked, why didn't God stop him? Here's a response I've heard from a number of members of the clergy. If you're wondering, God tried to sound the alarm. God could not stop him. God has embraced him, yes. He's in whatever afterlife you believe in. But God's actually sad. God wanted him to stay on this earth over his natural lifetime. But God has embraced him, yes. But God did not choose him to die by suicide. And I once attended a funeral for a suicide victim and was horrified when the clergy said, her burdens were so great. Because her burdens were so great, she had to come to God. If your burdens ever become great, you too should come to God. I wanted to scream, tell them to come to God through Bible study, through worship, through service. So we have a lot of work to do, and especially getting physicians more involved in suicide prevention, school principals more involved in suicide prevention, and ministers knowing how to conduct a service that does not promote suicide as the way to come to God. And the challenge is always on prevention. Here at NSU, in the Suicide and Violence Prevention Office, we have an original video on suicide postvention. There are clusters. There are mass clusters. There are point clusters. So when we have the suicide of a celebrity, the great concern has to be that this might impact the suicide rates all over the United States. There's some mixed research on whether or not this happens, but the media coverage is incredibly important. For example, the media did not need to give details about how Kate Spade died by suicide and specifically what color of scarf she used, because that almost guarantees that other women might use the same method and the same color scarf. point clusters, and I've responded to a lot of those all over the country. Well, what's a point cluster? Well, here's an example. Harriman High School, Jordan, Utah, had 7 suicides of students who attended the same school. That's more than we would ever expect. And to give credit to the Jordan School District, they have done a lot. And I've helped them in terms of training for all staff on what to look for, what to do, meetings for parents, implementing best practices programs for the curriculum, extensive training for all school mental health professionals. Very tragic, yes, but the suicides stopped. But that's definitely an example of a point cluster, because young people are the most susceptible to imitating suicidal behavior. And unfortunately, vulnerable young people with lots of problems find each other today. They cluster together. And I might argue the suicide of a young person has its greatest impact in history today. And I think you know why. It's because of social networks. And what we need to work to do is make sure somebody is promoting after suicide messages that say things like, this doesn't have to happen. This is not fate. Here is how to get help for yourself or a suicidal friend. And here's an example of very problematic media coverage. Robin Williams was much beloved, and his suicide had an impact all across the country. So let's imagine you live in a crappy trailer in Davie, Florida. You're on Social Security. You have health problems. You can barely pay the energy bill for your trailer, and Robin Williams kills himself. The impact of a celebrity suicide, and we've had a lot of celebrity suicides in the last year or two, can be very significant. And the daily news coverage pretty much violates all the known media guidelines. Do not make it front page news. Do not detail the method. Do not report it as simplistic, romantic, or unexplainable. Instead, do stories on suicide prevention, where to get help, somebody who got help, somebody who has gone on with their life. I have a few final thoughts, and I'm anticipating today that we are going to get a lot of questions, and Megan is going to help us with those questions. So what will happen to the suicide rate? Because we've had a pandemic. I don't think we really know. But I think, unfortunately, we would have to anticipate an increase, because many Americans have lost loved ones. And many Americans are really struggling financially. I'm proud to tell you that here at NSU, we started a fund to support students that are having financial difficulties. And I donated. And I actually hope that everybody listening that is still getting a paycheck thinks about a way they could help those that are less fortunate. This is a very critical time in our history. I believe it's extremely significant that every American knows the warning signs of suicide and is comfortable reaching out. After a presentation I did last year, a woman from Boston, Massachusetts, sends me an email. She said, I came out of church. I saw a young woman sitting on the steps. She was clearly distraught. I didn't even know her name. I sat down next to her. I touched her arm. I didn't really even say anything to her. Pretty soon she was talking to me. And finally she said, I don't think I want to live anymore. And I responded, I'm here for you. I know what to do. I know who to call. I will be there with you every step of the way. Suicide is the 10th leading cause of death for all Americans, but suicide prevention funding is significantly lacking because too many people think, oh, they could just snap out of that. So we need to dramatically increase at this very difficult time suicide prevention funding. And I hope everybody listening has just a little more confidence to ask directly, are you thinking of giving up? Are you thinking of suicide? So I would give anything to have that last conversation back with my father, because he exhibited a number of warning signs. It was clearly a goodbye trip to come see me in Muncie, Indiana, but I just didn't get that. And when he was talking about not wanting to live to be an old man, talking about what he wanted to leave me, why did I not grasp that? I was 25 years old, but nobody ever taught me those warning signs. And in particular, a few thoughts about schools. Kids are not in those brick and mortar buildings right now, but all school psychologists, counselors, teachers, social workers, everybody is working, but be really alert for changes in students' behavior, something they might say online, something they might write. Maybe they haven't even been showing up for that virtual class for some time. Get in touch with parents. Don't be afraid to ask some questions directly. And in the space of time today, I couldn't possibly walk you through all the important dimensions of telehealth, but I'm proud to tell you the National Association of School Psychologists has developed a guide, Comprehensive School Suicide Prevention in a Time of Distance Learning. And if you work in a school, please visit the NASP website. So before I start taking those questions, I am not hard to find. You'll also find a great deal of information at the NSU Suicide and Violence Prevention Office. You'll find original videos for suicide awareness training, suicide assessment, suicide postvention. You'll find a video where I interviewed 2 young women who spoke very eloquently about their struggle with self-injury. In our newsletter, you'll find interviews with some of the leading experts in the field of suicide and violence prevention. We did an interview with Dr. Thomas Joyner. We did an interview with Dr. Jobs. And with Dr. Jobs, I asked him a question. I said, David, I'm about to walk into a class. What do I tell these graduate students when they have a suicidal client? Here's his answer. Don't run away. They're alive. They're in front of you. You can stabilize them. You can develop a safety plan. You can get them help. And what am I saying to everybody listening today? Person's in front of you. They're having a difficult time. You can reach out and you can help them. Anyone can ask these questions. And the greatest thing holding suicide prevention back in our country is our unwillingness to talk about it. I'll quote our Surgeon General. More than 48,000 suicides a year in this country. We need to talk about it more in our homes, our schools, and in our religious churches, temples, and mosques. And I'd be remiss today without showing you these important resources. The Trevor Foundation, tremendous resources to help those individuals with the sexual orientation of LGBT. And by the way, the single greatest protective factor for a gay kid in America is parental acceptance. And the suicidal thoughts, attempts, and deaths for LGBT individuals in our country are 3 or 4 times that of their heterosexual peers. And everybody needs to know the crisis text line. You text any word like help, start to 741-741. A trained person, 24 hours a day, texts you back. And of course, the crisis hotline number. But Megan, what questions do we have?
Okay, so the first one. I'm concerned that suicide rates will skyrocket in the aftermath of COVID-19, but what do you think?
Well, my greatest hope is they will not skyrocket. And I think the thing that would prevent them from skyrocketing, we really need a national focus right now on suicide prevention in our workplace, in our homes, in our religious places of worship, and in our schools. But I think we would have to acknowledge it will probably increase. But hopefully, with more education and awareness, it will not skyrocket.
Okay, next one. What do you think is the single most important thing that we need to do to prevent suicide?
All right, great. And you know, in preparing for this presentation, I thought the most important messages I have to tell the audience, I'm going to say them. I need to say it. And then I need to tell everybody I said it. The most important message: be alert to the warning signs. Do not be afraid to directly ask your loved one, coworker, or friend, are you thinking you might give up? Are you thinking you don't want to live? We must become comfortable asking those questions. What other questions do you have for me, Megan?
Okay, I have, what protects kids and even all of us against suicide?
Well, in particular for kids, stable families. Unfortunately, not every kid lives in a stable family. And I'm really proud to tell you, I received the Helping Parkland Heal Award after that staggering tragedy. But a message that I've had to parents every single time is pretty simple. When a kid is shown unconditional love every way, every day by their parents, and when they live in a stable home, they can overcome almost anything. So stable homes, sense of being loved protects kids and all of us, being connected to our schools, our community, our workplace, having access to mental health resources, being involved in religion, and lack of access to lethal means. Those are the things that actually protect all of us.
Okay, and then someone asked, with elementary students, should my language be as direct as, are you thinking of suicide?
Great question. What I'm hearing all over the country, especially from like 4th and 5th grade counselors, is kids are talking about death and suicide. And I always get this question: do I need to take it seriously? I mean, he's only 9 years old. Yes, take it seriously every single time. Notify his parents. I know it's frustrating. I wish he could just say, I'm mad about X. He shouldn't have to say, I'm suicidal to get our attention. So we need to take it seriously. We need to recognize more and more elementary students are using the word suicide. And there's only really one curriculum program out there that's direct. It's a 5th grade program called Riding the Wave that uses direct language about depression and suicide. Most of our curriculum programs for students begin in middle school. We actually need a lot more research on developmentally what do we need to do with suicidal elementary age kids, and how do we talk with them about it. And I think it's really about, with an elementary age kid, when something just isn't quite right, they've got a bad feeling about something, get adult help.
Okay, and then someone else said, a question I always get during group support therapy for parents of children who died by suicide. I feel so guilty. I could have done something. If I was there, it's my fault.
Everybody always has these if only feelings. And to be honest, I shared a few of those today. But we have to remember the person who died by suicide traveled a very long road. It was essentially everything. It was everyone's fault, yet it was no one's fault. And what I've really found is often what helps survivors is to get involved in suicide prevention. Raise awareness, raise money, get involved in the American Foundation for Suicide Prevention, for example. And I'm proud to tell you that NSU, Florida, every fall hosts the American Foundation for Suicide Prevention Out of Darkness Walk. Hundreds and hundreds of people are walking, raising money in memory of their loved one. And they are taking steps to prevent future suicides.
Okay, and then I had another one who asked how they can get schools involved in the suicide prevention programs to get on board with them.
At the simplest level, and I'm just going to be really honest today, I don't think suicide prevention should be site-based. In Florida, it should not be up to an individual school principal. Suicide prevention should come from the superintendent and the school board, who will say, you will do X, Y, and Z for suicide prevention, and I will be checking. If you do more than that, great for you. But at the simplest level, what we really need is a suicide prevention task force for Broward County. And they should gather input from personnel within the Broward County system, personnel in the greater Broward County area, input from parents, input from suicide prevention experts, develop the policy and the plan that will be carried out every single year in every school.
Okay, do you want to take another question? I know we're getting towards the end.
I think we have time for maybe at least one more. So go ahead, Megan.
Okay, so I have another one said, at what age should you begin talking to children about suicide?
Really great question. And you know, when a family has lost a loved one to suicide, I believe they need to tell the truth, even to younger children. Too often, I meet somebody who says, I just found out what happened to my favorite uncle 5 years ago. Why didn't they just tell me the truth? Now, every family has to make this decision in their own homes about this conversation. But generally, I just told you, I told my son about the suicide of his grandfather at age 8. And I tried to reinforce in the next few years what to look for, what to do. So it's going to be up to individual families. But a closing thought that I have, because I know we're almost out of time, we must talk about suicide more in our homes, our schools, our workplaces, and our churches. And I believe every adolescent and every adult must know where to go to get help for yourself or your friend. And with elementary age students, I hope we can just teach them to recognize something isn't quite right. Go to the nearest adult, go to the teacher, go to the parent. Everybody must reach out and use these national resources. And my greatest hope would be we will dramatically increase suicide prevention funding in this country. I want to thank every single person for tuning in today, and NSU is very committed to providing community resources. And check out NSU/Shark Chats for many other presentations coming up from my colleagues. And Dr. Perez, is there anything you want to say?
Well, thank you very much, Dr. Poland. It's always a pleasure to host you, and you always bring in many individuals from many different disciplines that are interested in the subject matter. I think communication is quite vital. A special thanks to Megan and Janine, who have assisted behind the scenes. They're both clinical psychology students. We are Nova Southeastern University. We are in Davie, Fort Lauderdale, Florida, USA, our main campus, and we have campuses around the state of Florida, Jacksonville, Miami, Palm Beach, Orlando, Tampa, Puerto Rico, and of course, programs online. Our website is psychology.nova.edu, and you could reach us by emailing psychology@nova.edu. That's pretty easy to remember. And we certainly encourage you to share these webinars with your colleagues, your friends, your family. Recordings are available, and it's very simple address. It's www.nova.edu/sharkchats. www.nova.edu/sharkchats. So any parting words as we end the day?
Well, I was really so excited to have 1,000 people want to hear about suicide prevention. And I hope every single one of you will go to your school, your workplace, and in your family and talk about what everybody needs to look for and what everybody needs to do. And on behalf of NSU, we wish you all the best at this difficult time.
And please be positive and share your joy with your friends. Thank you, and please come join us again.